Hi everyone, thank you so much for joining us. Today we're going to continue our discussion from the last webinar on precision medicine and chronic care management. First, I'll give a little background on myself. My name is Sarah Howe and I'm Mazik Global's Program Manager for Clinical Healthcare and IoT Technologies. I've previously served as Outreach Captain and Cancer Support Specialist for Immerman Angels, a nonprofit organization providing personalized emotional support to those affected by cancer, as well as Vice President of Engagement for Relay for Life of Northwestern, a fundraising event for the American Cancer Society. I am passionate about incorporating emotional support into the standard of care and using technology to make healthcare personalized, engaging, and affordable for everyone. I'll introduce our other speakers next. First, we have Tracy Picone, Microsoft's Director of Healthcare for Dynamics. She is responsible for driving all aspects of business development, including strategies, solutions, strategic partnerships, marketing, and sales. Tracy has vast experience in the healthcare industry as a private practice administrator and extensive experience working for one of the largest medical device manufacturers. She is passionate about bringing technology solutions to the healthcare industry. We are also joined today by Patricia Becker, Mazik's Chief Strategy Officer. Pat has 25 years of executive healthcare information technology experience. She's previously served as CIO for University of Chicago Medical Center and University Health System Consortium. She is currently a HIMSS Fellow and adjunct faculty member at Northwestern University. To start things off, let's just reestablish the concept of precision medicine, which the National Institutes of Health defines as an emerging approach for disease treatment and prevention that takes into account individual variability in genes, environment, and lifestyle for each person. This approach will allow doctors and researchers to predict more accurately which treatment and prevention strategies for a particular disease will work in which groups of people. It is in contrast to a one-size-fits-all approach in which disease treatment and prevention strategies are developed for the average person with less consideration for the differences between individuals. Before we get into the demo, we'll give a quick recap for anyone who missed the previous webinar. Tracy, would you like to kick us off?
That would be great. Thanks, Sarah. And thanks everyone for joining us again today. So in our last webinar for precision medicine, we walked through the history of precision medicine, where we've been, where we're at, and what the future looks like. We also discussed the challenges around precision medicine. Specifically, we discussed the cost of genomic sequencing, which really has, well, it has drastically decreased. So in 2001, it was $100 million to sequence a genome, and in 2016, it was $1,000 to sequence a genome. And with that, we've also, with the decrease in cost, we've also seen organizations cater to and sell directly to the consumer, the patient. So with that, with the decrease in cost, that has subsequently led to an explosion of health-related data, and then to how do we secure all of that data, and then more important, or as importantly, how do we then use that data in actionable and an intelligent way. And finally, we discussed what has been brought to light is the importance of not just the genomic data that we now have and we have access to, but also the importance of including lifestyle, social, and environmental factors and all of that data that really affect all patients. And so today, we know that we have to bring in those additional factors along with the genomics that to create all of the available data to get that comprehensive view of our patients. So that's really, in a nutshell, what we discussed the last time.
So hi, this is Pat Becker. Good afternoon, everyone. I'm going to talk a little bit about the other factors that are related to precision medicine, and particularly how they impact on chronic care management. We know that chronic care patients have the most potential to benefit from precision medicine. Chronic diseases are shown to be affected by environmental and lifestyle factors as well as genetic ones. These factors can include many aspects, such as environmental factors like weather and air quality, or lifestyle factors such as diet and exercise, to things like a patient's cultural factors. How much interaction do they have? What are their family circumstances? So in order to effectively treat chronic diseases, care teams need to not only monitor genetic factors, but a patient's habits and environmental exposures. All the elements illustrated on this diagram can have an impact on health, and particularly on a chronic condition.
So, Pat, as you listed those, as you mentioned those issues, what is Mazik doing today to address those issues?
Well, today's clinical systems has a real gap in incorporating precision medicine results and data. There's a need to move to a more data-driven healthcare, but there's an overwhelming amount of that data, and we need to be able to synthesize what's the most influential data for a particular patient. There's a disparity also between what's going on in medical research databases and the clinical systems that provide patient care. Today's electronic health records are designed to incorporate, are not designed to incorporate and synthesize all this data. So Mazik Care has developed systems that will allow us to incorporate all the vast amount of data, as well as integrate with other applications such as wearable, genomic results, research databases.
This is Sarah again. So Mazik spent a lot of time analyzing where the healthcare industry is today with precision medicine and where it wants to go. And at this point, precision medicine is very clearly still underdeveloped and vague. So our thought process was to start thinking along the lines of how can we start setting up a foundation today to support everything that's going to come together in the future? And what is the breakdown of the steps to get there? So our goal was to provide a solution that has immediate impact in improving current patient care processes while also preparing for the future of precision medicine.
Which is interesting, right, Sarah? Because as Pat had mentioned, addressing those issues, as a provider, when they look at this, they're going to ask, how do I start today? Because this is big, right? Precision medicine is huge. Getting all of that information, so where do they start today? How can they start today? And how can Mazik help them?
Right. So we know that genomics is still developing, but we can't just wait for it to be ready. And we also know that genomics will never be fully effective without the lifestyle and environmental data analyzed against it. So we need this parallel movement towards providing lifestyle and environmental data in a framework that supports integration with genomic data as it becomes available for various use cases. So we've built an infrastructure for precision medicine that hosts lifestyle and environmental data and can also provide insights based on the holistic picture of lifestyle, environmental, and genomic data based on whatever is currently available, so we can personalize as much as possible at any point in time. So what we've talked about is how chronic disease is sort of the best way to start with precision medicine because these chronic diseases are so influenced by our lifestyle and environmental factors as well as their gene predispositions. And we know chronic care is a huge pressing issue in the healthcare industry as chronic conditions account for 86% of healthcare spending in the US alone. CMS has defined chronic care management as the non-face-to-face services provided to Medicare beneficiaries who have multiple chronic conditions. And they are now providing reimbursements on a per-patient basis based on how many patients receive chronic care management services, counting for at least 20 minutes of clinical staff time per calendar month. So if any patient that you provide 20 minutes per month of non-face-to-face interactions, you can receive about $40 of reimbursement for each patient. So one of the most interesting use cases for chronic care management is type 2 diabetes. 29 million people in the U.S. suffer from type 2 diabetes, and 80 million more Americans have prediabetes, which means they are susceptible to developing the disease. Diabetes is a lifetime journey that requires constant management and can continue to progress over time. And its effects are experienced differently by each individual. So this makes diabetes the ideal proving ground for precision medicine. So thinking of all those things, we have built out a flexible solution to manage patient care while utilizing the available precision medicine data and having a space for new genomic insights as they develop over time.
Sarah, just real quick, I know you're going to start your short demo here, but I'm seeing a few questions come in from the audience, so I just wanted to address. We will answer your questions at the end of this, and this demo is probably somewhere between 10 and 12 minutes, so please continue to write in your questions. We'll synthesize them and then answer at the end.
Sounds great. All right, we just switch screens here. So this is the Mazik Care application for chronic care management, and it's built on Microsoft Dynamics CRM. So I'm going to log in as a care coordinator, and the first thing I'm going to see is these built-in KPIs. So this is all configurable and role-based. So I'll see the information here that's most important to me as a care coordinator. So I want to know things like what is the level of patient satisfaction for the patients who I'm coordinating care for? And recently, we've also been able to provide insights on our CMS reimbursement statistics. So I can see here how many patients per month were able to hit that 20 minutes or more of non-face-to-face interaction that we can get compensation for from CMS. And I can see where maybe I need to do some improvement to get some of those patients in the 10 to 19 minute window up into the 20-minute window. I also want to know how many patients per month are coming in as direct referrals versus machine learning detection, because if I'm managing my population effectively, I can sort of use predictive algorithms to identify patients who might need to be enrolled in a specific program proactively. And I also obviously want to keep my readmission rate down as much as possible, so I have that KPI here. I can also refresh these on demand and make sure that I'm looking at the most up-to-date information. For slide over, I can also see the system pushing important information towards me, so I know what I should be most aware of. So I can see, for instance, Melinda Parse has a blood clot in her lung. I might want to take some actions based on that or assign some specific tasks to another member of her care team. I also have here our chatbot functionality where I can monitor communications among the various care teams. So for instance, Nicholas Graves just received and reviewed JR's INR test result, which was abnormal, and there's a need to increase his warfarin dosage. So here you can see we're HIPAA compliant. We're only referring to patients by their initials, and we also have established HIPAA compliance through HL7 integration. As I go over here, I can see other views such as my current cases or other worklets like missed appointments or incomplete care plans, whatever I would find most valuable. So in terms of diabetes and chronic care management, I will now show how we can use the system to facilitate managing a patient with diabetes. So Jen Doe is a patient who's had type 2 diabetes for 3 years. And the first thing I'll show is she meets with her physician every 3 months to check in, and we'll go through this encounter with her physician to update her information and make sure that everything we have is reflective of her current progress in her care. So I can see general information, most of that wouldn't change, but her lifestyle information, she might have changed her food plan or something. And I can add comments, and it creates this narration over on the side, collect information on her behavioral health, as well as emotional support and rapid eating assessment. And these would be used to allow us to have insights that we might want to modify her care pathway with them. So I'll show you next. We have this clinical pathway that is personalized and individualized to gen-specific lifestyle and environmental and genomic data. But here you can see, for instance, originally she used to monitor her weight or try to reduce her weight through jogging and swimming, and then based on other appointments she's had, they've changed that to running and swimming, and they've also created a goal for her to reduce her fast food intake to less than 2 times per week. So this is an example of how you can use the pathway and modify it over time to change based on Jen's changing needs. So we also have this care plan feature here where you can see some of those goals were reflected in the pathway. They're also monitored here. You can see where Jen was at her last appointment and where she's aiming to be. So currently, or the last time we spoke with her, she was exercising about 10 to 20 minutes per day. And by the next time we see her in 3 months, we want her to be exercising 30 to 40 minutes per day. And we can monitor these are configurable, so we can monitor whatever information would be most valuable for managing Jen's care. So like for instance, social engagement care. This can be important for diabetes patients because socializing can be a sort of sensitive topic, as social engagement can often revolve around food and things like that, where patients with type 2 diabetes might have restrictions and feel less inclined to attend. But on the other hand, social engagement can often, social interactions and emotional support can often be a motivator for patients to stay adhering to their care plans and managing their diabetes well. So monitoring her social engagement can allow us to see how well she's managing her care and how she might be doing mentally. As you can see, she had been only engaging in 30 minutes of social interactions per day. So hopefully the next time she has an appointment, she has been able to increase that to an hour per day. So over here, I can also see her follow-up appointments and her medicines. And here we have in a section for anomaly detection. So her care team can configure CRM workflows that will send an alert based on various anomaly detection parameters, such as sleep. So Jen, we know that she has started working 2 jobs and she's been concerned about getting enough sleep. So we have set up an alert where if she sleeps less than 5 hours a night for a full week, we will get a notification, and in whatever manner our care team members would like to receive that, whether that's a secure text message or an email or a notification in the app, and that will also send a notification to Jen based on her preferences of communication as well. So with that, I will show you we're storing a lot of data that allows us to stay on track of these goals and her progress in real time. So if we go to her patient chart, we see we have like a full medical profile with all kinds of information about her medical history. So we can see her care team, and you can contact them, and we can see which family members she has included that she might want to also receive notifications or alerts. Within here, we have this lifestyle tab. So you'll see these KPIs are very closely related with the goals that have been established in her care plan and her clinical pathway. So I can I could get an alert for sleep and know that I might want to check on not only her sleep, but see how she's doing in the rest of her life with her exercise and her diet. And I might notice, oh, she's stressed. We have she can monitor stress through a device that measures your skin, and it can indicate your stress levels or hydration levels. And I might notice also she's only getting 45 minutes of social engagement, so I might set up a call with her care team member, or I might assign someone on her care team member to call her and have one of those 20-minute non-face-to-face interactions that I can then put towards her reimbursement and also help her to get back on track with her care plan.
Hey Sarah, just real quick. This is Tracy. I just want to showcase here, when we're looking at this dashboard, the power of the dashboard is that you have all of the information right there at your fingertips. So a call that would be based on normally one interaction or concern can actually encompass the entirety of the patient. So you can talk to them about the diet and the exercise and the wellness because you have visibility. There's a transparency layer of all the information around that specific patient. And really that's what the patients are looking for, right? As patients start to consume healthcare, they're looking for an opportunity to interact in ways with their providers that they've never done before. Having information like this at their fingertips is a way to accomplish that.
Exactly. And so we're collecting all of this information, but this is just the starting point. We also have this section here for genomics, and we can see that Jen took this diabetes genetic test 3 years ago before she was diagnosed, and it gave her some indicators that she was at high risk for diabetes. So it gave her these top recommendations for delaying the onset of diabetes. And if I click here, I can also open up and see like the full results from that in more detail. But this is just an example of what is available today. As genomics develops over time, we'll have more and more insights and genomic data that we can incorporate into this app right here, where we can analyze it collectively with our lifestyle and environmental data. And we also have a space here to incorporate environmental data. So what we have here is data coming from Power BI based on the hometown that Jen is from, which is Marietta, Georgia. Georgia has a high rate of diabetes, and I can see here the social and environmental context of where she lives. And I want to know these things because they can all have an impact on the way she manages her care, such as the obesity rate. This is just a correlation, but it can give us insight into the social and cultural norms, and it can also indicate accessibility to resources that enable Jen to live a healthy life, like access to healthy foods, etc. And that can have a huge impact on her ability to manage her diabetes. If I look over here, I can also see this temperature alert. It's red because the temperature is 97 degrees, which is extremely hot. And if I click on this, I can see the impact that heat has on diabetes. So it's telling me here, compared to the average for a year, the summer months are much hotter and therefore have much higher incident rate of hypoglycemia. And based on this graph, I might want to provide some suggestions or strategies to Jen for preventing hypoglycemia events, which might be to keep her medicines in a cool place, or to work out only indoors at a cool gym or before or after the sun goes down, and to make sure that if she has any injuries to her feet, that she gets like immediate medical attention. So we can automate this communication. As this alert is created, we can also push a notification to Jen based on her preferences and to the care team based on their preferences as well. So if I slide over here, I can see another visualization tool, which is this map, and I can layer on these various elements of environmental impacts and provide the combined context of Jen's environment and how her specific environment is going to impact her, and then I can act based on that. And as a care coordinator, if I were in my population view, I could also see this map for all of my patients and see how these environmental conditions are affecting the entire population that I'm coordinating care for, and how many people I'm automating those proactive strategies and alerts for. So this is our framework that provides the lifestyle, environmental, and genomics data. And as genomics develops over time, we will be able to add these anomaly detections based on machine learning or insights that are generated from this holistic view of the data. From all of the facets of each individual's life, we can provide these more specific insights. So we know, like, every day we're seeing all kinds of articles about genomics and different use cases and technologies that are getting developed, but there's still a very long period of time until those really become fully usable, or for precision medicine to become fully usable. So in the meantime, we're getting increased demand from patients for personalization of their care based on all of these specifics. So what we have here is a way to start personalizing their care in the immediate future with this lifestyle environmental data, and then build in the genomics over time as it becomes ready. So this sort of concludes our demo.
Sarah, do we have a few minutes for a couple of questions?
Yeah. Oh, one thing I really quickly want to highlight is this notification here. It's a panic result for Mike Patton because his respiratory rate was above 95 beats per minute for 1 week. And this is an example of something that could indicate stress. And I can see here my care team is reacting to it, and they want to call him and schedule a heart stress test. So that's an example of how an anomaly detection alert might show up in the system. Sorry, didn't mean to cut you off there.
No,
yeah,
that's perfect.
Let me just.
So one of the questions that came in was about mobile apps, mobility, and we're seeing that more and more, right, as healthcare workers are going to the home. So what are the mobile capabilities of this solution?
We have a fully developed mobile app for the patient, and their family members can use it as well. So you can see here it's kind of designed in a similar way to our web app, where you can have your lifestyle data, you can see your communications that are specific to you and talk to your care team in a secure way. And you can also sync your various devices, and you can receive notifications, and you can update your vitals, and those will all report back to the browser and update your patient information.
Perfect. Okay, I think we have time for one, maybe two other questions. So the number one question that we always get is integrations. Healthcare organizations have multiple solutions, and they're using different technologies throughout their organization. What's the integration?
We have full integration capability with our standard interface layered on top for any EMR.
Okay, and you know what? You answered that so fast because clearly you guys are fully integrated. There is one more question. So what do you do with the older population that maybe doesn't have the same use of technology that so many of us are using today, with having multiple cell phones and whatnot? How do you use the technology, or how do you interact with those? How do you help providers interact with that older population?
Yeah, so that kind of goes back to what we're talking about with these patient preferences. So we have the capability to integrate with all of these wearables and the mobile apps and everything, but for patients who don't like to use technology as much, then when we talk with them about their preferences for communicating, they might choose, rather than integrating things, they might select a plan where they maybe call in and use like a phone call center and answer some questions on their keypad between appointments to keep their care plan updated between appointments, but they might choose not to have so much direct communication or technology-facing interaction.
Okay, very good.
Okay. So yeah, last thing before we close out, I just want to talk about the chronic care management market a little bit, there are 36 million potential beneficiaries from CMS, and in 2016, only 275,000 actually had compensation come in from these non-face-to-face interactions. And so out of a $17 billion market, only 12 million has been utilized so far. So there's a lot of room for this kind of chronic care management app to allow providers to get compensated for things they're already providing to their patient. Like many of them are already giving their patients this extra attention between appointments, and they're just not getting compensated for it. So this app allows for this kind of effortless linking with the billing and the claims cycle for CMS, and that can generate a lot of revenue that doesn't really require any extra effort on the provider side. So we are offering an analysis workshop where we can work with you to figure out how you can improve your CMS reimbursement rate, build a foundation for precision medicine, and decrease your admission rates. So I'll be sending out links to sign up for that following this webcast. And with that, I think we're ready to close up. Thank you everyone for joining today, and I will follow up shortly.
Thank you, Sarah. Thank you, Mazik team.
Thank you, Tracy.
Thank you, Tracy.